So, good afternoon, and thank you everybody for attending my presentation and for the organizer for having selected this paper that I'm co-authoring with Professor Simona Iammarino from the LSE, and then the paper has also recently been published in the Journal of Economic Behavior and Organization. So, in this paper, what we try to do is to provide a quantitative measure of the effect of the local provision of specialized support in stimulating victims of sexual violence to report the crime. So the issue appears to be interesting, starting from the fact that sexual crimes are severely underreported, and this huge rate of underreporting, in fact, implies impunity for perpetrators, which in turn implies that they can target an increasing number of victims, and at the same time, they can repeat victimization on the same target. Overall, this impunity of perpetrators contribute to the huge socioeconomic and emotional cost related to sexual violence that it has been estimated, for instance, at the European Union level to amount to 220 billion per year, which equals more or less to 1.5 of European Union GDP. This, of course, has pushed institutions to look for the effective policy initiative that can be stimulate reporting by survivor. To this, we can also add that both for institution and practitioner, the local provision of specialized support may be useful in stimulate reporting. Why is this so? Well, because the provision of locally available, easy to reach and discrete places in which victims can disclose the incident may counter some of the most frequent barriers that are acknowledged to hinder the propensity of survivor of disclosing the incident that are related to the fear of exposing themselves. So the fear of not being believed, the fear of social stigma, and the fear that the perpetrator will retaliate. So instead of going directly to the police and report, having a safe and discreet place that is close by may help the victim to disclose. And this is the first stage in the process that then may lead to seeking justice. And we also know from qualitative evidence from the UK, the European Union countries, and the US, that actually through survey targeting survivors and focus group, survivors acknowledged that after getting in touch to this kind of support, they felt more empowered. And this empowerment actually led many of them to disclose the incident. What is lacking, though, is a quantitative evidence measuring the effect of the provision of these services on the actual reporting. So what we aim to do is to provide this quantitative measure targeting a specific case study that is England and Wales. So why England and Wales? Well, there are several reasons, starting from the fact that unfortunately UK ranks extremely high in terms of the incidence of sexual violence against women. The last figures put UK in the third position in the European landscape. The second reason is that in 2011, in the UK and mainly in England and Wales, because Scotland shielded the policy, there was this policy shift regarding the provision of specialized support, which decentralized the entire policy to the local authority level, meaning that the local authority are now in charge both of the decision of whether to provide a service or not, that is discretionary, and also to the funding to the local budget of this service if they want to provide it. And this policy shift was combined with the beginning of the austerity program, which overall implied a strong reduction of government funding that was previously benefiting local budget of English and Wales local authority. This policy shift had huge consequences, according to practitioner and institution, up to the point that 5 years after the introduction of this policy shift, so in 2016, nearly 60% of women that tried to access specialized support were turned away due to lack of capacity. And this amount to more or less 12,000 women in a single year. Together with the reduction in the overall capacity, what also happened was that this specialized support started disappearing from many places. In these two maps, I'm summarizing what happened. So the map on the left is the geography of specialized support in 2010, so 1 year before the introduction of the policy shift and the austerity program. And the orange area are the area in which specialized support was provided. You see the same map, but in 2017, so 6 years after the introduction of the policy shift. And you see that the gray area, so the area in which there's no local support, have increased significantly. And we have measured this increase, and we can say that in this 7-year, the distribution of specialized support across English and Welsh local authority decreased by around 30%, which is a lot. The relevance of this phenomenon went outside the interest of practitioner and service provider reaching newspaper headline. Here you see a title from the New York Times, but also the Guardian, the Independent. I mean, they devoted thorough investigation to the issue, as well as independent Bureau of Investigative Journalists, like the one I'm reporting in this slide. So overall, this seems to suggest that England and Wales are an interesting case to address. And we address this case through a quantitative case studies in which we are going to compare the evolution of the propensity to report sexual crime by women in a local authority that decided to implement and finance the service after the introduction of the policy shift, with the same trend in a local authority that is quite similar to the one that we select, but that decided to decommission the service after the policy shift. So in a way, we are exploiting the policy shift that I was referring before, because it allows us to have this source of variation that allows for causal inference. So to recap what happened in 2011, so the first point is that local authority did not have any mandatory requirement on providing the service. So it was their own discretionary choice. At the same time, differently from before, up to the choice of providing the service, local authority had to use their own local money to finance it. Together with this, government ad hoc funds that were previously benefiting this kind of services were heavily cut. And on top of this, the introduction of the austerity program implied that the overall government funds that were flowing to local authority budget were heavily cut. Out of this, through our data, we saw that over 2/3 of local authorities across England and Wales actually decommissioned the provision of specialized support. And of course, the remaining 1/3 decided instead to prioritize the service and to put money in this. In this 1/3 of local authority, we selected Brighton and Hove as our unit of investigation, and I will explain you in a few slides why is Brighton and Hove. And what we're going to do, as I said, is comparing the evolution of the propensity to report sexual crime by women in Brighton and Hove with the same trend in a comparable local authority. So the first thing that we had to investigate was whether Brighton and Hove decided to prioritize specialized support for local reasons, starting from the fact that maybe they had a super high incident of sexual crime, so maybe they had a political emergency. We checked for this, and it appeared that is not the case. Here you see in the chart. The chart reports some figures from Brighton and Hove in 2009, so before the introduction of the policy shift, and 2012 and 16. And you see that the city council increased the budget devoted to the specialized support. At the same time, the number of victims that went to the service increased, as well as the rate of reporting, whereas the incidence of sexual violence in the city appear to remain stable. So it appears that there was an emergency driving this policy choice. And from the policy document of the local authority, we saw that it actually was a commitment by the city council to assure the well-being of their citizens, even in time of austerity. And this is also confirmed by the fact that the local authority was also shielding a local budget devoted to other social programs that were devoted to vulnerable groups. The other thing that we checked was whether Brighton and Hove maybe was benefiting from milder austerity cut compared to other local authorities that could have made for them easier to decide to prioritize this kind of service. It appeared that is not the case. On the contrary, in this graph, you see the comparison between the cut in government funding of Brighton and Hove with respect to the other local authorities. These are the blue lines. Brighton and Hove is the dotted line, the other local authority is the solid one, and you see that actually Brighton and Hove experience even heavier cut with respect to the other local authority. So it appears that Brighton and Hove is a good unit for our investigation. So how do we proceed? So we measure the propensity to report sexual crime using police record on sexual crime by women. And given this, we also need to have selected local authorities in which police has a good performance in the management of reporting of sexual crimes. And this implied for the UK, we used the independent audit done by the government, and we had to discard several local authorities because they had really bad auditing when it comes to the management of this report of sexual crime. I'm going super fast on this. This is the map of the local authority that, fit with our criteria. So these are the local authority that we will use to build our comparison for Brighton and Hove. And these local authority are characterized for having a police force that has a good management of survivor report of sexual crime. They have the same endowment of specialized support as Brighton and Hove before the introduction of the policy shift, because it's obvious that Brighton and Hove had support also before when they were financed by the government. So it appears that comparing Brighton and Hove with local authorities that did not have any specialized support before the government intervention was kind of putting different opportunity cost on the local authorities. Then our estimation technique is a synthetic control model. So what we are going to do is to compare the trend in reporting of Brighton and Hove with the trend of reporting of a synthetic counterfactual that is designed through a weighted average of local authority that are similar to Brighton and Hove along important dimensions that are acknowledged to affect sexual violence against women. Here you see which are the relevant variables that we consider and that we give to the algorithm to design the synthetic Brighton and Hove, and is of course the share of population aged between 16 and 44, unemployment, both male and female, wage differential between men and women, the incidence of drug crimes, of homicide, overall data about crimes, including the perception of crimes from the Understanding Society database, and the share of female police force, because previous study acknowledged the share of female police force as a factor that can favor reporting of sexual crime by women. So the first thing that we need to do is to check whether, given the data that we are providing the algorithm is capable of designing a synthetic Brighton and Hove that is close to the real Brighton and Hove before the introduction of the policy shift. Here you see the result. You can compare the figures in the two columns. The first one are the figures for the real Brighton and Hove. In the second column, you see the figure for the synthetic one, and you see that they are super close. This is telling us that our synthetic Brighton and Hove is really close to the real one before the introduction of the policy shift. So it's a good proxy of Brighton and Hove. Then we also checked which are the local authorities that are contributing the most to the design of this synthetic counterfactual, to check whether, these local authorities are super close to Brighton and Hove, because maybe you can have, spillover effect, or if there's a huge effect of London Borough. It appears that is not the case. Overall, we have 66 local authorities that are weighted by the algorithm to proxy our synthetic counterfactual. Coming to the result, here you see what happens. So the graph on the top part of the slide is showing you what happens to the propensity to report between Brighton and Hove and its synthetic counterfactual after the introduction of the policy shift. That is when Brighton and Hove decided to provide the service, whereas the synthetic counterfactual decided to stop the service provision. And you see that the propensity to report in Brighton and Hove is higher. You see the gap that starts when the policy shift happens, and it remains higher for all the further years till 2016. And you also see, looking at the chart in the bottom, that for every year that we are considering, there is a positive and significant impact of the provision of specialized support in reporting. And here you see it even better. We estimate that more or less each year having the provision of specialized support increase reporting by 20% compared to similar places in which the service was not provided. The other thing that we checked was the relevance of this U3 effect. So I think you're all aware of what the U3 effect is. In any case, is this high impact media campaign that happened in the UK that is acknowledged to have promoted reporting of sexual crime in the UK. You see that even if we focus in the year in which the U3 effect happened, again, the reporting in Brighton and Hove is higher compared to the other places. We also checked, as I said, for the effect of the local endowment of female police officers, because we know from recent papers targeting the US that an high share of female police officer may help survivor to report because they feel more confident if they have to face a female police officer rather than a man. And even when we control for this, our result remains significant. Then we did a battery of robustness check. I'm going super fast here. So we checked for the specification of our model, placebo test, a falsification test, to look whether some of the unit that we are using to build the counterfactual was driving the result. This is not the case. And then we also checked whether there could be different policy explanation for our result. For instance, if Brighton and Hove was experiencing an overall increase in reporting of other types of crime, like homicide, theft, racially based crime, but this is not the case. We check whether the effect could be driven by other policy strategies, such as declare law, but this is not the case. Even when we control for this, our result remains robust and significant. And then we check for using other potential competing model specification, such as a difference in difference, a generalized difference in difference, and a trajectory balancing. Our result remained the same. So it's not the choice of the model that is driving our result. So overall, up to this point, we are able to say that the local provision of specialized support services appears to have a positive effect on the survivor propensity to report. And this positive effect remains there even when we control for other potential policy initiative or media initiative that can, push reporting by survivor. I mean, they are competing, but they don't change our result. Of course, we can't say anything about the individual probability of reporting because we are looking at data at the local authority level. So I can't tell you whether the level of education or the ethnicity of the woman has some effect. Overall, our findings relate to several strands of literature. We provide evidence supporting the fact that having a local specialized support for victims of sexual violence has a positive effect in their propensity to report the crime. And also we contribute to the literature on the role of local policy in influencing population behavior. And of course, also we can also contribute to the effect of austerity-driven policy on local service and what this generates on people living in local authority. And finally, our paper provides support to the Istanbul Convention, that is the first regional legally binding policy addressing violence against women and girls, which contains among the mandatory requirement for country that subscribes to the convention, the uniform distribution of this kind of specialized support. And thank you all, I'm done.